Well, welcome everyone, and thank you for joining us today. We're excited to be partnering with Dan Roman today from Roman Brokers to bring you this free webinar on Medicare education. And so before we get started, I just wanted to introduce to you our presenter today. Dan has worked in the medical health and wellness industry for about 30 years. And so he is a licensed, insured, independent broker who represents most of the major medical advantage plans, the supplement plans, as well as the Medicare prescription drug plans. So our objective today is for Dan to answer any questions you may have regarding Medicare options as well as benefits, especially with the upcoming open enrollment right around the corner. So Dan, without further ado, I am going to pass this over for you to get started.
I am Dan Roman with Roman Brokers Insurance, and I am local. That's a big plus for you. Believe it or not, you'll probably get a lot of calls over this next coming months, and a lot of those people won't be local, and they won't understand kind of the more important things about not just plan benefits, but say what hospitals are important in a specific area. And stuff like that. So having me local is a real important benefit for you. Now let me see if I can advance this. There we go. A little bit about me. Sandy graciously introduced me with a bit of that information that you see on this slide here. So I won't repeat all of that other than just re-emphasizing I am licensed, insured, and an independent broker. And that's real important for you as well, because I do not represent one company. I represent most all the major Medicare Advantage, Medicare Supplement, and Medicare prescription drug plans in Arizona. And I also cover Utah and Colorado as well. So we're going to go through just a 101 of Medicare so that you kind of understand how Medicare works. And we'll start with who is eligible for Medicare. Typically, you're going to be 65 and older, but you can be on Medicare if you're under 65 and receiving Social Security with disability insurance payments for more than 24 months or 2 years. And really, there are some that with any age, like end-stage renal disease and ALS, and quite frankly, most of any disabled person that qualifies under Medicare's definition of a disability, you can be any age and still have Medicare. You do have to be a U.S. citizen or a permanent resident, and you will have 3 ways to join Social Security. Now I'm talking about after you turn 65, because this is by far the most common time when people are eligible for Medicare. You will automatically be enrolled if you're under 65 and already on Social Security. You'll automatically be enrolled in what we'll talk about the parts, Part A and B. But if you do not have Social Security when you turn 65, you will need to take an active role in applying for Medicare. And as you can see on this screen, you don't go to the Medicare website to apply for Medicare. You go to the Social Security website and do that. And your best way right now with COVID and everything like that, it is best to apply online if you can. You can still call Social Security and apply over the phone, but it is a much more time-consuming process right now, because you have to call them, schedule a time to meet. They will call you back at that scheduled time, and then you'll go through the application. And there's just been a number of my clients that have had issues with going that way. You can go to the local Social Security office too when COVID is not happening. But right now, I do not believe that is really even an option for people. So it's by phone and online is your best bet to do that. If any of you ever have an issue, if you're not already on Medicare, just let me know and I can help you through that process. So there are 4 parts to Medicare. The first 2 that you see on this slide here, the Part A and the Part B, those are what they call original Medicare. So when you apply for Medicare, What you're typically applying for is Part A and Part B. Now, once you have those, then the other options down here, 3, 4, and 5, Medicare supplements, Part D, drug coverage, and Medicare Part C or Medicare Advantage plans become an option for you. And we're going to talk about each one of these parts a little bit. Part A, though, is what you typically get for all those years you've worked. You usually work 40 quarters or 10 years in order to be eligible to have Part A without a premium. And this provides your inpatient hospital care, skilled nursing facilities. This is where hospice care is covered, and limited home health. This is not obviously all the things, but these are the major things that Part A covers. And as I mentioned, you work for 40 quarters paying into the Social Security system to have a no premium Part A. And that's where most people are at. The vast majority of people are going to have Part A with no monthly premium associated with it. You may have a premium if you haven't worked that number of quarters, and that will be kind of prorated, getting lower and lower as the number of quarters you've worked increases. Some people don't qualify on their own because their spouse was the primary income earner. And so they will still be able to qualify based on the spouse's work history. So now let's look at Part B. Part B is the part that covers your doctor's visits and preventative services like all those exams that they always want you to take with like colonoscopies and mammograms and such. Outpatient surgery is covered here. Diagnostic screenings, any labs basically are covered under Part B. Emergency care, and then durable medical equipment like wheelchairs and CPAP machines and the supplies associated with those types of things. Your Part B premium, very few people do not pay a Part B premium unless they are on a low income subsidy. Now, the vast majority of people are going to be paying in 2021, that's this year, it's $148.50. This goes up a little bit each year, but that $148.50 premium is the typical place where people land when they start collecting Social Security and apply for Medicare. You can see that it graduates higher as your income levels are higher. So this is based on, usually if you look up at the very top here, it says based on annual adjusted gross income from 2019. So there's usually a 2-year lag for when how they calculate what your Part B premium is going to be. So there is a way to appeal that if your income is dropping significantly once you retire, and then you can still get into that $148.50 range if your income is going to drop that significantly. Late enrollment penalties. If you do not sign up for Part B when you're first eligible and you're not continuing to work and still covered by your employer plan, you will incur a late enrollment penalty that will never go away. So it's important to really seriously consider and get some advice on when to sign up for Part B, because that Part B late enrollment penalty is 10% for each 12-month period that you could have had Part B but didn't enroll. I have a lady right now I'm working with that has right now she's at a 9-year late enrollment penalty. And because of Medicare's rule, she can't actually apply until next year. And so she is going to have a 10-year late enrollment penalty. So she's going to be paying 100% more than she would have. But she really needs to get Part B now because she's got health issues that are, going to be significant if she doesn't get the coverage that's offered under Part B. So original Medicare, most people think, well, Medicare is going to cover everything. No, it does not cover everything. It covers 80% of the things that Medicare covers. So in other words, let's say you go to a doctor and the doctor's bill is $100 and it is an allowed charge. Well, that means Medicare, after their deductible for Part B, will pay 80% of that. So you would still be on the hook for $20. Not so bad if it's a $100 charge, but what if it's a $100,000 charge from a hospital? Same thing applies. Medicare pays 80%, and you would end up paying the other 20%. So you can see it can get pricey. There are things that it does not cover, like the deductibles that are associated with Part A, which is about $1,400 this year. Part B's deductible, which is a little over $200. Then there's co-pays, it's co-insurance for original Medicare, which is that 20%. And then there's no drug coverage in original Medicare. And it doesn't have any added benefits like hearing aids or eye exams, and most dental is also not covered. So what do you do to make sure you're not stuck with a bill like a $100,000 bill from a hospital, which quite frankly, that's pretty low these days. It doesn't take much to get to $100,000. Well, you have two real main options. That's a Medicare supplement and then a Medicare Advantage plan. And we're going to talk about each of those. So Medicare supplement, that can fill some of the gaps that original Medicare does not cover. What it is really good for is that it covers all the deductibles and the co-insurances associated with original Medicare. So that 80%, it will pick up the 20% of whatever's covered by original Medicare, and it will pay the deductibles. And it also adds a couple of other things as well, but not really many added benefits. It's very flexible in that there is no real network other than doctors who take Medicare. But just to make things confusing, I'm going back a slide here. You notice that original Medicare is divided by parts, and they have letters to them: Part A, Part B, and then there's Part D and Part C. Well, Medicare supplements, just to confuse you, use plan letters. So when you see Plan F or Plan G or Plan N, as this slide talks about, that's what a Medicare supplement is. It's a plan letter that denotes what the coverage is for that specific plan. And every Medicare supplement follows the exact same coverages under those plan letters. So you can see Plan G is the most robust in that it covers everything except for that Part B deductible. So by far the vast majority, I don't think I've put anyone on any other plan except for Plan F, which is no longer available, Plan G, and Plan N as in Nancy. All the other ones, for various reasons, are not really something that people prefer. So that can be confusing to understand that parts, when they start talking about Medicare Part A, that's different than a Medicare supplement Plan G. Okay, so Medicare supplements don't cover drugs, as we talked about. So you would need to get a drug plan in order to have full coverage. Something we didn't mention is Medicare supplements come with a premium, and those premiums go up every year as you get older. Part D drug plans also have a premium. So if you're going the route of original Medicare with Part A and Part B, and then getting a Medicare supplement and a drug plan to limit your risk in Medicare, you're going to have three premiums. You're going to have Part B premium, you're going to have the supplement premium, and you're going to have the drug coverage premium. So typically standalone drug plans, those are going to be used with a Medicare supplement plan. But you can also get them under a Medicare Advantage plan, which is where we're going next. You do have to live in the service area when you're getting drug coverage, meaning typically it's either by county or by state or by region. There is a late enrollment penalty associated with Part D for drug coverage. This is the one I see the most common because people think, well, I don't use any drugs, I don't need to get a drug plan. Well, that's something to seriously consider as well, because while the late enrollment penalty is fairly inexpensive, it's 33 cents for every month that you're late in enrolling. It never goes away either. So it's something to consider which direction you want to go. Now let's look at Part C. What Medicare Part C does is it takes Part A and Part B and combines that with Part D and puts it all together in Part C. So Part C really is the combination of those three put together. And the beauty of these is that there are plenty of them out there that have no premium. So you eliminate the supplement premium and the drug premium. You'll still have to pay your Part B premium of $148.50, but not adding another premium to the plan can really be helpful. There are Medicare Advantage plans with premiums, monthly premiums, and those make sense in certain situations, and that's why it's very individual how you approach Medicare and in choosing a plan that's right for you. These do have managed care networks, so you would choose a primary care if it's in an HMO, and even in PPOs, they want you to choose a primary care a lot of times. You may need a referral to see a specialist. Used to be all the HMOs required it. Now there's a real move. A lot of them do not require a referral to see a specialist anymore, even in the HMO networks. There's very low or no premiums available for plans available with no premium. And then there's a whole bunch of added benefits that these plans, they just keep getting better. A lot of these, the key ones people are looking for is vision benefit, dental, and hearing, but there are a host of other benefits that they can include as well. And not any one plan is going to include all of these, but a lot of them include the majority of these. For example, pretty much all of them include a gym membership. There will be over-the-counter benefit included in a number of these plans, where that gives you a certain amount of money every month or every quarter that you can use. Order maybe your vitamins that aren't necessarily covered or stuff like that. I have one family that orders incontinence supplies for their mother out of that, and then her mother, her and her husband all have the same plan, so they get a huge benefit by doing that. So there are many different things in these catalogs that you'd normally go to a grocery, like a CVS or a Walgreens and pick up, that would probably be covered in that over-the-counter benefit. Some cover transportation, which would be picking you up and taking you to a doctor's office and bringing you back. They can have chiropractic, acupuncture, therapeutic massage. I even saw one recently that covers reflexology. And for 2022, there's even going to be a plan that covers naturopathic doctors. Yes, first time I've ever seen that. They have plans that have a flex benefit. And the flex benefit is they give you, let's say it's $3,000 to spend in the year, and you can use it either for gym equipment or chiropractic or acupuncture, or maybe it's the naturopathic doctor. So you have this pool of money that can be used for any of those benefits. There are even plans for people who don't really go to the doctor much, and they will give you back part of your monthly premium on your Part B premium. And it goes back to Social Security. So it just reduces the amount that would normally be taken out of your Social Security check for Part B, or if you're not taking Part B, the amount you would pay. There are meals that are offered after discharge from a hospital. So you can see the list goes on. There's plenty more that can also be covered. So enrollment periods, when can you enroll? Well, you know that this is a very timely presentation that we're doing here today, and I thank Sandy for getting ahead of that with her clients. Annual enrollment period is December 15th through December 7th, and that is for people who are already in either a Medicare Advantage, Medicare Supplement, or prescription drug plan to look at their new options and make a change. The initial period, when you turn 65, you have a 7-month turning 65 period. And it's 3 months before, the month of your birth date, and 3 months after. So that's when you can enroll without incurring any late enrollment penalty. Then there's open enrollment, and this is really only for people in Medicare Advantage plans from January 1st to March 31st. I call it the whoops window. And the reason I call it that is if you got in a Medicare Advantage plan and maybe there was this is a real example I've had. I had a guy that told me all his doctors, and we looked him up in all the networks, and he had one that he forgot to tell me about that was really important. And that doctor was not in the network for the plan he chose. So we had from January 1st to March 31st to make one more plan change. And we, of course, were able to find a plan that had all his doctors, including that one he forgot to tell me about. And so we were able to make one more switch. April 1 to December 31st is called the lock-in period, where there's no longer an option to make changes. And then there are a whole host of special enrollment periods, like if you move out of the service area of your current plan, or you now qualify for a low-income subsidy, which, by the way, low-income subsidies, I can help you understand what the cutoffs are for that, and even help you apply if that's something that you're interested in. Star ratings. Star ratings are something Medicare devised. It's a 5-star rating system, and they use all kinds of different quality measures, including surveys from members, even the providers, to see which plans have the best overall star rating. And so you can have a plan, a 3-star plan would be average, a 4-star plan would certainly be above average, and then a 5-star plan, which I haven't seen one in Arizona for some time. They're very difficult to get, but if there is a 5-star plan this for 2022, you can actually enroll in that plan all year long. So that all the plans really are incentivized in a number of ways to keep their quality high and their member satisfaction high as well. And this is a way you can look at the plans. And just one more way, I would say, I wouldn't base everything on the star rating, but you can look at that and say, that's a 4.5-star plan. That's way above average. So that's another way, another point to consider when we're looking at plans. So my services to you, first and foremost, none of my services cost you anything. So because of that, there's really no reason not to talk to me. So if you enrolled in a plan by using my services, then the plan would pay me a commission. And the nice thing about that is all the plans pay the same commission. So there's no incentive to me to put you in one plan over another one. I just want to make sure it's the best fit for your needs and preferences. And I help you understand your Medicare options, like through seminars like this, and then getting it very personalized. Because I do make personal appointments. I can do it over the phone, through Zoom, or I can come to you if you prefer that, which the majority of my clients still prefer that. I review benefits and co-pays and co-insurances with you so that you can make an informed decision. I'll look up your doctors, make sure the hospitals you prefer are in the networks if there's a network involved, and explain when you can enroll. And find plans to cover your medications at the lowest cost possible as well, because there are differences in the plans in terms of how they cover your medications. So as well, if there are 3 different savings programs that can help you as well if you're on the lower income side of things. That would be a Medicare Extra Help. There's programs involved that the federal government subsidizes. The Medicare Savings Program is another federal one. And then there's Access for the state, which is the Medicaid. And all of those can work with your Medicare to reduce your costs, either by lowering your drug costs, your Part B premium, or giving you even more services. So I think that we are at the end. I ran through that really fast because I want to be mindful of your time. But if there are any questions, I'd love to take those now.
Yes, there is a question here, Dan, if you have a moment. Somebody is asking, should someone always choose Part B? If not, when would Part B not apply?
Okay, so that is a personal preference question, but I will tell you, I've only had a few people not choose Part B and then not regret it later. Most of the time when I deal with people who have not chosen Part B, it's several years later and now they have a health issue and they wish they would have had Part B. For example, chemotherapy drugs, very expensive. Those are covered under Part B. So if you don't have Part B, you have no coverage for chemotherapy drugs. None of us know or hope that happens to us, but that is a very significant reason to consider Part B coverage. The people who opt not to take it that I've seen are actually people that have made a very informed decision. They're people who are self-insured. They put away enough money that they've decided, you know what, I'll just pay for my healthcare costs out of my, self-insured fund that I have. So I hope that helps. The vast majority of people are going to want to have Part B. Yes, it's a premium, but $148.50, that is not a whole lot of premium compared to what else is out there in the market. I hope that answered the question.
Awesome. Thank you, Dan. One additional question. You had mentioned early on that, for the Medicare, it's 65 or older, but can you just touch, and again, just touch just briefly, because I know there's probably many pieces to it, but how does that work from a Medicare standpoint for those prior to age 65 that may have a significant life event and possibly qualify for early Medicare?
So that's a great question. As I went through really quickly, there's a 24-month period where you have to be on Social Security with disability. And once you've been on it for 24 months, you are eligible for Medicare. But getting that designation that you are qualified for Social Security with disability, it's a process. It takes time, depends on your diagnosis. If it's end-stage renal disease or ALS or some of those that are very, very, streamlined, I should say, for the process, it's going to be no problem at all getting on that. But if you're more in a nebulous zone, which I see a lot of people with disabilities out there, that they have to go through a process of applying for Social Security with disability. And I honestly think that most of them would do best by actually getting disability attorney involved, because the process, it's almost guaranteed you're going to get denied the first time. And so if you don't know how the system works, then you're going to give up when you could have probably gotten on it. And it's well worth getting on if you're disabled, to get on Social Security with disability before you turn 65.
Awesome. Thank you. All right. I don't believe there's any other questions at the moment. Dan, I do appreciate you joining us today and helping shed a little bit of extra light on Medicare in general. I know Medicare can be very confusing for some, and there's so many moving pieces, it seems, and it seems to always be changing.
Yes.
So, definitely for our viewers, if you have additional questions that come up after listening to this and you want to get in touch with Dan, again, he can be reached at 480-636-9677, or you can reach him at dan@romanbrokers.com. And again, we're Arizona Care Hospice. We always love to partner with our community partners in providing the best resources for our families. If we can be of any further resource to you and or your loved ones, you can reach us directly at 480-588-8200. Thank you so much, Dan. I hope you have a great day, and we look forward to connecting with our viewers in the near future. Thank you.
You too. I appreciate the opportunity.